Hello, everyone. Welcome, welcome, welcome. Thank you for joining us for this conversation today with the DC Beings. My name is Kenya Hutton. If anyone that knows me knows I wear a couple of hats in DC. I'm the Deputy Director at the Center for Black Equity. I am the co-chair of the Capital Ballroom Council. I'm one of the commissioners for the Commission of Health and HIV, et cetera, et cetera, et cetera. And I am going to be talking today with a good buddy of mine, colleague, friend of a number of years, Derrick Strawberry Cox. I know you're on that side. Tell the people about yourself.
Well, good afternoon, everyone. I'm Derrick Strawberry Cox. As you know as well, I wear many hats here in DC as well. Vice Chair on COHA, DC Black Pride, Capital Pride, Whitman Walker, BHT. The list goes on and on. But I'm here to have a wonderful conversation with my boy. Yeah.
Okay,
it's like
awesome. So what we're going to be talking about today is the status neutral approach, right? So happy to hear about this new strategy coming to DC, the status neutral approach to HIV education and prevention, where, no matter a person's HIV status, they're given the attention they need. What do you think? What are your thoughts on that?
Well, I feel like everybody should be treated the same way, no matter what their status is. You should just be welcomed arms, especially when you're going to any provider, no matter if it's your provider or any provider. They should just welcome you open arms, make sure you feel safe and comfortable.
Right. All right, awesome. Well, everyone that's watching, we have a quick video we want to show you. Just going to really explain, the history of HIV here in the district, and what this status neutral approach really is going to be. If any of you guys are ready, roll the film.
Have you heard of status neutral? What does it mean to be status neutral? Well, it describes a world where HIV is no longer transmitted and its damaging stigma has been removed. In this world, we're all treated the same, regardless of our status. Each person, positive or negative, receives full and equal attention. And no, it's not too good to be true. Creating a status-neutral world is possible and could end the HIV epidemic in a single lifetime. But before we can get there, we must take a look at our history. Starting in 1981, a rare illness arrived in the U.S. and had many prejudiced labels due to its connection to homosexual men. The media didn't pay much attention to this disease until women, heterosexual men, and infants were affected. And by fall of 1982, this disease finally had a name: Acquired Immune Deficiency Syndrome, better known as AIDS. In 1983, the CDC identified at-risk groups. There wasn't much knowledge about HIV and its link to AIDS, which left the door wide open for stigmatization. AIDS patients were often isolated from family and friends, fired from work, and denied care from healthcare workers who feared the virus. Much of the stigma lives on, but ending that must be the first step to building our status-neutral world. No group of people is more likely to contract HIV than any other. Behaviors carry the risk, not the person. Many, including the U.S. government, ignored HIV, even as it began to affect more people. But the community at large took action. Whitman Walker Health was the first responder to the epidemic by establishing DC's first testing program and opening one of the first clinics for AIDS patients. Their action and that of many other organizations was instrumental in providing care and support for those living with HIV. Their work and activism helped develop trials for HIV treatments, making status neutral possible. But how do we achieve it? HIV treatments like AZT are crucial, but not everyone had access. Though AZT was widely used in 1995, it didn't always get to those who needed it most. And once the epidemic hit American soil, it wasn't long before HIV disproportionately affected the Black community. How did it happen that Black people are 13% of the U.S. population, but 42% of new HIV cases? It started and still continues with the lack of access to hospitals and quality health care in majority Black neighborhoods, leading many African Americans to less favorable settings, like emergency rooms with no continuity in care. Most also lack access to affordable medication, which is critical in managing HIV. In 1996, everything changed with highly active antiretroviral treatment. When it's taken consistently, it can reduce an HIV patient's viral load so much that the virus is undetectable in the blood, making it impossible to transmit. Did you catch that? Undetectable equals untransmittable. Treatment put a status-neutral world within reach. And it's happening here. There are about 12,000 people living with HIV in DC, but the number of newly diagnosed cases dropped 79% thanks to the implementation of a plan in 2016 by Mayor Bowser and the DC Department of Health. It aimed for 90% of DC residents living with HIV to know their status, receive treatment, and reach viral suppression. Preventative actions like regular HIV and STD testing, condom distribution, PrEP, PEP, needle exchange programs, and others are moving us toward a status-neutral world. PrEP is a daily pill that reduces the risk of contracting HIV by up to 92%, while PEP can be taken within 72 hours after possible exposure. Sounds great, right? But less than half of the patients prescribed PrEP are members of Black and Brown communities, which are most affected by HIV. HIV stigma makes many reluctant to get tested, disclose their status to their partners, or seek care. But research and treatment have made HIV completely manageable. People living with HIV are thriving. Each day we're closer to a status-neutral world, made possible by PrEP and U equals U. There's no shame in being sexually active, talking about HIV, or knowing your status. We must remove the artificial lines that separate us from care and prevention. To know your status, go to getcheckdc.org for a free at-home HIV test kit for DC residents. Learn more about PrEP, PEP, and U equals U at sexualbeing.org.
Awesome. What do you think about that video?
It was nice, and I felt bad for whoever the drawer was. I know it was
A lot of drawing, right?
I know, right? I was like, okay, that's nice. So,
yeah,
it was very. I like how it was condensed into like 4 minutes. You would think it seemed long, but it was a lot of information in 4 minutes. I was like, okay, that's cute. Nicely done. Kept my attention.
Good. It was nicely done. And so I want to unpack some of that with you. You know, first of all, shout out to Whitman Walker, DC Health, Mayor Bowser, DC Beings, for really, working on addressing HIV here in the district. Say that little bit of history about HIV in the United States in the district. What are your thoughts on that? How did that make you feel?
I mean, I want to say it made me feel good because we've come so long as far as one pill, but then it also irritates me because it feels like something that we continuously talk about, and yet we still have people. That don't want to know their status, and even if they do know their status, they don't want to be treated for it or take the meds for it. And it's irritating, a little overwhelming, but overall where we've come, I love that. How far we've come.
Okay, yeah. No, I totally get that. So, you mentioned about sometimes individuals don't want to take the medication or get tested. Do you think something like the status neutral approach will be able to change that, and if so, how?
I do believe something like that will be able to help, but we still have to get them there first. That's always that first step to get them there. And you have so many people that either that don't believe in the hospital or they just don't trust the hospital. I know so many people that believe in that saying where I was fine until I went to the hospital.
Yeah,
and it's a real thing, and I get it. It is a real thing because you feel completely healthy until you go to the doctors and they're like, well, you got this, and this, and you're like, what? Now I feel sick. So
yeah. So let me ask you a question. What has been your journey through DC when it comes to around the arena of HIV? I see your t-shirt. You got this is what an HIV advocate looks like, right? So what's been that journey like around HIV and advocacy?
Well, for me, the journey's been wonderful. It's been amazing. Like, I love helping people, and I love all the respect and the support that I myself been given and been able to give to others. The only part that I wasn't necessarily, okay with was when it came to me helping other people. And if I sent them to people that I, kind of like either depended on or counted on to give them that support, and they didn't give them like the best either response or just experience, I'll say, and it turned them away. Like it wasn't for me, or they was rude, or they didn't make enough time for me, or I felt rushed. So it's just like we lost one. Because it only take that one bad experience for one person to go along like, yeah, I went there, that place wasn't good, or they treated me like this or that, and it's just like go another bad rep.
Right. So let me ask you a question again. So talking about that and talking about the bad experiences, right? How can status neutral approach if providers, right, in a perfect world, and all providers, was able to implement the status neutral approach from that front door, from that front person, all the way to seeing the doctor. If we all adopted a status neutral approach with dealing with customers that walk in the building, what kind of difference do you think that might make?
I feel like everybody will feel comfortable going to see their providers and actually look forward to it. I mean, hell, like the first time I got a pimple on my butt, like me and my doctor, we so good. I got her cell phone number. I'd be like, I need to see you. I don't know what's wrong. I'm clean. Why is it on there? But I didn't know you can get pimples any and everywhere. But they just look forward to going to their doctors or any provider at that point. If they go in, they feel welcomed and they just feel loved and supported from that moment, from sitting in the waiting room up until seeing their doctor. It just, everything will work. They just click like 1, 2, 3.
Mm-hmm. Okay. All right. Awesome. So as a community, what's important for us living here in DC, cisgender, trans, black, white, queer, straight, everybody, right? Right. Everybody. What's important for us as a community?
Well, first, I would say what's important for us as a community is acceptance and acknowledgement for each other. But then outside of that, I would say if we could increase access to affordable, high quality, non-discriminatory healthcare services and insurance benefits for the LGBT people. Like if we can start there, we probably move up the ladder just a little bit.
I'm glad you mentioned that. You talk about so what about what kind of resources are available for community when someone wants to get insurance or get tested? What kind of resources do you know of that you would this is not a paid endorsement, make clear, but so who would you like to so what are some resources we can send to people as far as not just getting tested but also getting insurance?
Well, I know for everyone, there's a program for everyone, but it is more programs for those with HIV. And I know when people do come to the DMV area and they come from all over, but now they currently live here, and if they are able to reach out to me, I always send them to the housing counseling services because they help them out. They help them out with food stamps. They help them out with food cards. They help them out with housing, and they even help them out with their cell phone bill, or if they already have housing, then they help them out with their rent. So it's so many different programs for everyone. And then even if you do have a doctor or a provider, then they can also help you out. And they're not always saying these programs are going to help you out right then and there, because there's always a process to a program, whether you're in it or you get started in it. But there's a program for everything. You just have to go through that process.
Okay, so you talked about the process, and shout out to Family Medical, Housing Counseling Services, and everyone. So what about getting tested? What about that first step? Where are some spaces that individuals can go and get a test?
Oh, there's so many places where you can go get a test at. I mean, if you want to get tested at your local doctors, you can do that. Or if you can go to any nonprofit organization where you feel comfortable with, like Us Helping Us, AHF, Whitman Walker, the list goes on and on.
Damien Ministries, there's tons of places. And if you want to get tested at home, if you look down at the bottom of the screen, there's a ticker for free HIV test at home. That's 100% confidential at home. Yeah. Visit getcheckdc.org. So I want to talk a little bit about test results, right? What's some advice or some words of advice? Because you mentioned earlier that you like to help individuals, right? Help people. What about someone getting a positive result? What's the best way for individuals, both a provider and a consumer, to handle those results?
Well, most of the times when people do find out that they're newly diagnosed, the best thing to do right then and there is, give them a moment, let them take it in, and then make sure that they understand their diagnosis. And then make sure that they have support. And whatever that support is, they need to either be there or they need to be on the phone with that support. So after that, then they can start working with their provider, and then they can start their meds or whatever that process of starting their meds or medication or support looks like to get them on their meds. Right.
What about for prevention? Say someone comes in and they get tested and they come out negative. What should be the next step? for someone that if they get tested, results are negative, non-reactive is the appropriate term. So someone comes in and that happens. What are some ways of engagement that service providers should be able to engage in for community?
Well, we do know we have a lot of people that love to have, condomless sex, as they say. And when they do come in from a little scare or so, and they do still have their negative results, we recommend that they take PrEP. And PrEP is just a daily, once a day pill that can provide the extra protection that you need from HIV. And it don't protect you from STDs or STIs, but it do prevent you from getting HIV.
Yeah. No, that's awesome. I'm gonna switch also now over to something that was mentioned in the video. Is U equals U, undetectable equal untransmittable. Shout out to Prevention Access for really pushing that campaign. How is that gonna be beneficial, or how, what kind of benefits do you think can come out of really getting that message of U equals U out?
So when I tell people about U equals U and I express and stress the meaning behind it, it's like you still get to live your life to the fullest. You still get to have unprotected sex if you choose to, or condomless sex, however you want to put it, for the correct terminology. And you still just feel human. You get to feel humanized, because a lot of people feel dehumanized because they got HIV, they feel disgusted, nobody will want them, they feel scared to have unprotected sex, and so it helps. It takes a lot of that stress and worry and weight off your shoulders, and it just makes you feel like you can still dig in that situation of that free world that you want to call being sexually liberated.
Choosing your words. See, choosing your words. All right, no, that's cool.
Yeah.
So I want to talk about a little bit about community events like DC Black Pride, for instance. We're both affiliated with DC Black Pride. I am the deputy director for the Center of Black Equity. I really focus on DC Black Pride a lot. You have been a volunteer for many, many years. You are our Volunteer of the Year award. So you're in the fabric of DC Black Pride, right? So when we talk about treatment and engagement, what are ways we can as a group about engagement and treatment, what would you like to see represented when we talk about like DC Black Pride and engagement and treatment and care?
Well, I would still like to see continual for us to have these open, free sexual talks, for people can just feel sexual liberated, because it's still, the sex talk is still so taboo. I don't understand why. But because we talk about sex all the time. We definitely have sex all the time. I mean, most of us wake up and we bust that morning release. So it's just like, you start the day, you end the day. So why not? Whether you're doing it with yourself or with somebody else. I mean, we all doing it, no matter how you identify. Sex is just something we all do. We all are lustful human beings, and we thrive in it. We live in it. Pleasure is a real thing, and you should want to talk about it because you need to know what pleases you and what pleases your partner, or just what causes you pleasure in general.
Yeah. And also, again, shout out to DC Beings. If you look again at the ticker on the bottom, visit sexualbeing.org to learn about how sex is a natural part of being.
Yes.
To your point. So I want to flip around now. I'm bouncing back and forth because I'm taking questions from the audience and I have my notes and stuff here. And I want to really make sure that, we really have a good, strong conversation. See people say we have to normalize pleasure. Yes, we love it. Pleasure is important. But how, some words of advice, right? From the audience. So words of advice about engaging friends and family to test for HIV if they haven't, or if they feel they haven't been exposed to HIV.
Well, so most of the times, I'm gonna say majority of the times. We just skip to the real. Majority of the times, I would take my personal time and I would go with a friend or a family member, to go get tested, just so I can be that extra support, make sure that they have a good experience, 2, that they feel welcome and supported, and 3, whatever the results are, that they know that they got somebody right there that will see them all the way through up until they can do it on their own. Because I'm not a therapist or a counselor, but I can be a strong support and a mentor. That's about it.
Okay. Support is important, right? Support is
Yeah.
important. It's important to, have these support systems in place, because they can help. I've been in calls and meetings, especially recently, with some folks, and we talked about the importance of like picking up the phone and calling that friend, right? But turning it back to the status neutral approach, do you think, like, trying to frame my question here, you know, part of the issue is, when people walk into the door, there is that stigma about, oh, you're walking in here because you probably have HIV, so people don't want to be seen, right? How can organizations that have been typically known to be HIV serving organizations, right? Like, for example, like the Us Upping Us, is the Whitman Walkers, Damien Ministries. How can what kind of public facing actions can be done, so that the community understands, that organizations are status neutral, and just because someone's coming in, they're not, doesn't necessarily mean that they're HIV positive.
So that's a little tricky question because I mean, even with working with GMHC in Fairfax, Virginia, and working
Shout
at
out to
Alexandria Health,
DMHC.
working at Alexandria Health Department, we saw so many people that came from DC just to come all the way to Virginia just to make sure that they didn't see nobody else in DC. And then, being at Whitman Walker or ASF or Damien Ministry, you see people that come from Virginia that comes to DC to make sure they don't see nobody in Virginia.
Yep.
So I mean, it's always that stigma because it's going to always be stigmatized just going to the doctors in general because everybody feel like if they see you at the doctors, then something's wrong with you. Like, so you either coming because you got something or you coming to see if you got something. So and it's always that stigma that's attached to it. Like, it don't even matter if you got an appointment. Like, even if you're there to be seen at the dentist, no one knows. They just see that you at the doctor.
Yeah. So how can what can we do about that stigma as a community, and as service providers? What can we do about that stigma?
The only thing that's on my mind that I can say we could do about it is, just get them out that waiting room as quickly as possible.
Okay.
But no, I mean, other than that, I mean, you just don't care. I mean, because if I need to go to the doctors, I'm going to the doctors. Like, I'm not worried about, for me personally, I'm not worried about who I see or who I'm going to see by. I'm making sure that I'm good. Like, my health comes first. So regardless of why I'm there for a reason. And it shouldn't matter.
Right. Okay. All right. Awesome. What would we, reflecting back in the video, and we saw the numbers of individuals that have tested positive and things that we've gone through. Where do you think we would be today if, as a nation, right, we all adopted the status neutral approach back then, 20, 30 years ago, right? Where do you think we would be right now, with HIV?
I want to say that we probably would have a cure, but that hurts funds, so I'm not gonna bring that up. But but I'll say that we would definitely we would live in a you equals you type world, and it probably wouldn't be that big of a deal, and we probably wouldn't even have that many cases out there, newly diagnosed cases, because everyone would be well protected, and everyone would know their status, and they'd just be on top of everything, and we all just protect each other in general, no matter how sexually liberated we were.
Yeah, and folks will be willing to go get tested, right? Because there's no longer a stigma about it. Like, when you walk, and you're not going to be treated as, oh, this person is this or this person is that. And you walk in the door, and you're going to get the same treatment like everybody, whether you're positive, whether you're negative. When you walk in that door, you get the same treatment, and you get all the things offered to you. I think that kind of might help along with the stigma and normalize HIV. Or this is a conversation about HIV, right? Because we've come a long way. As we started the video, we've come a long way. Thank you to all the people whose shoulders we stand on, right? Because there's been a lot of people. I can't even, I'm not even going to try to attempt to start naming the name because so many people that have been, out here before us during the fight. And I'm sure, to see us, adopting the status neutral approach, try to normalize the conversation of HIV, I'm sure they're going to be happy. And I'm sure those that are still around are happy as well. I want to segue and pull some questions from the audience. Let's see what we have here from the audience. I see something from Nikki Morant. So the idea of same level of care of everyone sounds great. How does that help in HIV? Talk to us about it. How would that help HIV and HIV if we're able to like give the same level of care to everyone when they come in, when they walk in the door?
Well, with the same level of love and care, then you wouldn't necessarily feel uncomfortable. You'll feel welcomed, and then you'll actually probably look forward to being on your meds. You feel comfortable talking about what you do sexually or what you don't do sexually. If your meds do something to you, you just feel comfortable and open about speak about everything that affects you inside and out dealing with HIV to whoever your provider is. If you
Right.
already feel loved and comfortable going in, so it's just like all your needs will be met. So before you leave that doctor's or that provider, you have everything that you need. You won't feel rushed. You won't feel uncomfortable. You won't feel degraded as a person. You'll feel welcomed. You feel loved. You feel supported. And you feel like everything you needed was taken care of.
Awesome. You know,
And that just sounded like love to me.
Nikki has another question about, and this one is really around Black and brown folk, right? Let's see here. It says, yeah, we are 13% of the population, but 42% of new cases. How can we change that? How can we change that for our community? That, like the video said, and like the comment here says, it's really been impacted by HIV disproportionately.
Well, it's kind of hard to always change the outlook of anything, but you just want to continue having these conversations, or just start them support groups, or attend them for support groups, or support those that are affected by it, because anybody can be affected or infected with HIV. Whether you're the person living or dealing with it, or whether you're the person that loved them or surrounds yourself with them. So it's just like you just got to continue to give that love and support, being that ally, doing what you need to do to just show up and be there.
Okay. All right.
For right now, make it happen.
For right now. All right. Let's take that. I see a comment here from Andima Umoran. Why aren't Black and brown people being prescribed PrEP? Is it about access? It's a two-part question. Why do you think they're not being prescribed? And is it about access? Is access the reason why they aren't? So 2 questions, 2 answers. Go.
All right. So we had a discussion before about why Black people and brown people weren't being provided PrEP. One was because most of them, when you mentioned it, they wasn't worried about it because, as Black people, we're not going to take a pill. What is it? I don't know what it is. What's it for? I'm still going to do what I do. I'm not worried about that. Some people did jump on the bandwagon with it, but, some doctors and providers, with being honest, they feel, because it's all stigma. It's all stigma. We just gonna be real about it. They feel that it's just a waste of time if they offer it to us, because statistic shows that we're not going to take it. Even if we do get it, it's a waste of money, it's a waste of funds, or it's a waste of product. So they don't offer it unless we ask for
it. You actually brought up something. So you're saying it's So you're saying it's really about the medical community not being willing to. Do you think having access to it has anything to do with it, or is it really just about it being prescribed?
Well, so when it comes to having access, for some people, depending on their location or whatever their health insurance look like, or even though that still shouldn't even be a problem, because the programs we got in store for that if you don't have health insurance. But sometimes people can't get there to get that medicine, even though we can mail it to you. But then it's a whole living situation if you do have a home. But then if you do have a home, if you stay with your parents or if you stay with a lover, you don't want them to see the pills, or it's so much behind it. But it's affordable and it's available to any and everyone.
Yes, I agree. PrEP is, they are increasing PrEP access, but we do have folks that are in some parts of the country, even parts here in DC, that access is a problem, right? For some of the things you mentioned, like the insurance information, the confidentiality question, the stigma, right? Remember when PrEP really hit? There was the whole thing about the Truvada whore and all that kind of stuff. So that's definitely something we should consider. But I don't want to touch back on the prescription piece. I know it's just interesting you said that, and that's taking me off like my my stream of questions because
Like,
I
I'm just being
remember.
real. So.
No, and I appreciate that. I appreciate that because I know of situations where individuals were not getting prescribed PrEP. I remember myself when I asked for PrEP years ago. My doctor said, "Oh, I don't know nothing about that. Let me refer you to that. She referred me to a DIS, a disease intervention specialist." And I was just like, I don't have anything. I just want to get PrEP. So
Okay. I just want the
yeah,
pill.
you know what I mean. And I also know of someone that went out and asked their doctor about PrEP, and their doctor turned to them and said, "Isn't that the HIV pill?" So it's interesting that you brought that up because it's also about like knowledge that sometimes we think our doctors should know all these things, but they don't. And it's important upon us as consumers. We shouldn't have to, but it's important to us. We have to almost educate our doctors on what we need and advocate for that. There was a question that came up earlier. So two questions that I want to double back on. One from Ann Weissman about what's the best way to advocate for your own sexual health with your doctor, which ties into this question right here. So I'm glad you brought that up. What's the best way to advocate for your own sexual health?
Educating your doctor. Like I tell people, like if you feel comfortable with yourself, you have to let your doctor know what's going on with you. Because if I go to my doctor and she asks me what's wrong or why I'm here today, if it's not a scheduled appointment, then I'm gonna let you know. Like I feel this way because I did this or I did that. Like if I was taking some dick this day, then I probably feel like I got ripped back there, or I probably took something a little too bigger than what it is expected. Like if I did it raw or if I did it with a condom, like you just have to educate your doctors because I mean it's a give and take once you're in there. Like your doctors should be educated on a lot of things, but they're not educated on you as an individual because you have to understand that they do see multiple people for multiple reasons. And I don't expect my doctor to remember everything that we always talk about or what we go through because I'm not going to put that pressure on her because I know she has other clients. But if you're honest with them and you open with them, and I mean, because you should want to be honest and open with your doctor because it's your health, it's your body. Like I feel like my body is my temple, so I'm gonna let you know everything that's going on. So I'm gonna help educate you so you can fully diagnose me for what I need to do to get whatever the problem is out the way so I can get back to doing what I want to do.
I know that's right. I see another coming from Nikki talking about. She's saying that it sounds like medical profession may add to the stigma without even realizing it.
No, sometimes they do, and most times when I tell people if they have a bad experience somewhere, like at any nonprofit organization or even at a health clinic, you need to let that person know. You have to. What I want people to do is start holding these people accountable, even if it's at the food stamp office, at the IRS building, whatever. Like if you have a bad experience with somebody where they just unprofessional or they just made you feel some type of way, we need to learn how to start getting these people names and holding them accountable because we don't need this to continue. Like if you don't want this job, then you don't need to be here because I need to feel accepted, comfortable, and safe when I come into these spaces. I don't need you down talking to me, looking at me some type of way, judging me, anything. I don't need any of that. I need to come here, even especially if I'm already irritated or agitated for whatever reason. I just need to come here and get what I need to get done. And I just need you to have this smile on your face, whether you want it or not, and just welcome me, listen to my problems, and help me do what I need to do. Yeah. And then you can send me on my way.
Yeah. I'm reading some of the comments, and yes, it is frustrating to often have to educate your doctor, but it's also important to remember that you have a choice, right? If your doctor isn't supporting you, you can always find another one.
Always.
Yes, thank you for that. Thank you for that. Doctors' offices need to be safe spaces. They need to be. Oftentimes they aren't, which is why we love the status neutral approach, right? Because it should be a safe space. This person, Delan, it looks like they hit it right in the head. Like this needs to be safe space, and status neutral approach is a great way to create a safe space when you come in there, so you'll be able to talk and everything.
Well, I want to take a second to also playing devil's advocate for the providers and everybody that do work in these health fields. They do deal with a lot of attitudes and irritation throughout the day. So, we got to sometimes meet them halfway. Sometimes it is a little overworked and overwhelmed, and I get it. It's their profession. They did pick it. They did choose it, and they get paid to do it. And I understand that. But if you put yourself in their shoes, sometimes,
Yeah, no, I understand. So I think we might have a couple more questions coming out of Facebook, YouTube. If you're watching, is I'm Kenya Hutton speaking with Derrick Strawberry Cox, talking about the status neutral approach being rolled out here in DC by DC Health. Please comment, questions. We're here. This is just a community conversation. We're just chatting with our influencer. Yeah, you're on that side. Derrick Strawberry Cox. He is an advocate for the people, been out here in these streets. So if this is a great time to ask questions and get some questions answered from the people on the pavement. So how can someone get life insurance if they have HIV, if they're HIV positive? What do you know about that, the insurance field or market?
Well, for the most part, I know if you, like I said before, if you moved from anywhere to the DMV area, or if you currently live in the DMV area and you don't have any health insurance, I would help you get you red carpeted. And so that's like a program where we just automatically enroll you. And if you are HIV or whatever you're dealing with, we help you get the meds that you need right away. And we put you already on the signage to get you signed up for either DC Medicaid, Maryland Medicaid, or Virginia Medicare. And we get that process rolling. We find out what the living situation is, what the job situation is. We dig deep. We do what we need to do, but first we take care of your health, and then we find out everything else. Okay. So once you get red carpeted, the process begins, and you will be taken care of.
You said we. Who's the we that you're referencing?
Anybody that need it, that don't have insurance or any health insurance. Like if you don't have any health insurance, you reach out to either your provider or somebody that you know, like me, and we'll help you get red carpeted.
All right, everyone, shout out to Strawberry. Strawberry will help you get red carpeted. So I see another comment that we might have here from Indima. Yumoran, do you have any tips for building the confidence to talk about sex openly with your partner or a doctor? Which is interesting, right? Because some things we talk about a partner, we don't talk about a doctor, and vice versa. Some things we talk about a doctor, we don't talk about a partner. So thanks for that question. So what kind of tips can you give the audience, give people watching this today and watching this for time to come about talking about sex openly with your partner or your doctor?
So the tips that I can give you for that is mostly, especially when you're dealing with HIV, I have a Peer Plus One program with Whitman Walker. The first thing we always talk about is just understanding your diagnosis, and I want to help you make sure that you got support behind your diagnosis. So, and once we get through all of that, I want to make sure that you accept your diagnosis. Once you're able to accept your diagnosis, then you can feel comfortable with actually talking about it, letting other people know that you have it, especially when it starts with your family or whoever your support team is, and then we can lead that on to your loved ones. Even if you don't want to tell your loved ones by yourself, you can always have your support team there with you. It's so many different various ways that you can do it, and it's always a process, and it's on your time. There's no time limit to where you have to disclose your diagnosis to anybody. So once you feel that safe, comfortable space with whomever it is, whether it be your provider or the lover of your life, you let them know, because you live in your truth. You own your diagnosis. You accepted it. You acknowledge it. It's not holding you back. So we try to go through that mentor-mentee program of owning your identity and owning your status and owning your diagnosis as well. Because your diagnosis could be anything, not just HIV. It could be cancer, diabetes, acid reflux. It could be anything. So you want to have support behind all of that.
Yeah, agreed. Absolutely agreed. And where can people go to engage them in things? I know you mentioned what's the name of the program you have at Whitman Walker?
The Peer Plus One program.
Your Peer Plus One program is there. And other programs, other initiatives such as POL and healthy relationships that some organizations in the district provides, like HIPS provides some of them, or something else provides some of these workshops.
Yes, definitely.
And they do is it really helps build individuals, confidence, and gives you really tangible tips and tricks to discuss sex, discuss status, discuss things with your partner, with your friends, with your community. It's good. I see Nikki here posted a comment about getting tested at home. And this is why, Okay, this is why the ability to get tested at home is so important and valuable, because people want to feel safe around their health concerns. That's why it's important, So that's why, again, shout out to the link on the bottom. You see it right there, getdc.org. Free HIV tests is 100% confidential at home. There's some other organizations that do it as well. I know Heart to Hand does it. I know Damien Ministries offer it. Get into the habit of taking control of your health. Another great place to find information is DC Health and Wellness Center down on 77 P Street. You can always go there and get for everything. I'm horrible. I can drive there, but don't ask me the exact address. Though that's how I'm most of these. I can tell you turn on this corner and turn on that corner, look at the light posts, see the statue. But yes, definitely go to DC Health Wellness Center on 77 P Street. You can also engage them for further testing and further STI testing as well. And I know they have been working nonstop through the pandemic, which is great. So shout out to them a lot. They're the DC Health Clinic, right? So if you can't go anywhere else, right, you can't make it to one of these other organizations we talk about, you're not sure that you might, be having funding or whatever, but you can always go there and get the services that you need. And, from there, you can branch out to other organizations in the DMV area, but definitely check out the DC Health and Wellness Center at 77 P Street. If you want info on getting a test, again, check out getcheckeddc.org. Oh, I bit my tongue. COVID-19 did a couple of things. I'm bouncing around. COVID-19 did a couple of things, right? It actually forced a lot of healthcare providers to embark fully on telehealth, right? Which is important. Telehealth has been around for a while, but because of the pandemic, it's really pushed telehealth to the forefront. How do you think things has telehealth, or do you think, let me ask this question, do you think telehealth has increased access to care and testing experiences, due to the pandemic and possibly even after the pandemic? Because my firm belief is that it's going to be around for a while. So how has it really changed? Has it been good or bad? What do you think?
So I would say both good and bad. On one hand, they did make everything virtual, and they did start doing, they can send it to your, they can bring it to your home. They let you know when they're at the door, you can pick up your meds or food or whatever, whatever your needs were, they would bring it to you, which was awesome. But then on the other hand, certain people, that needed therapy, they didn't really like the over the video chat, because they needed that in-person experience, and it was taken away from them. So we did have that little increase of suicide, but outside of that, a lot of people, for the most part, like I said, it's good and bad, because you had some people fall off care, but then some people fall into care. But it's still all about the follow-ups. So, because the telephone system's not always that great. I try to tell people, before they go anywhere, to call and just make sure that place meet their needs before they go there, before they don't feel like their time is wasted.
Right.
But unfortunately, the telephone systems at a lot of these organizations, I'm not gonna say screwed up, but they just still need a little bit work behind it. So,
yeah, because what happened is COVID came and where people was going on a slow pace, trying to up ramp it. COVID came, was like, you got to get on it and get on it now. So of course, everything wasn't 100%, but I think it's helpful. I do think it increases access. This is my personal opinion. I think it does increase access, because I may not want to go to the clinic. I may not want to go here, but I might be able to get on my phone. However, on the flip side of that is, something we talked about briefly earlier, was the access, right? Yeah. Because, I see a couple questions here. Yes, and I'll talk about that in a second. It's access, because everyone doesn't have a smartphone. Everyone doesn't have unlimited data. So those individuals that don't have a smartphone, have unlimited data, to be able to sit and talk to a telehealth professional, it's kind of rocking a hard place. But the question popped up: have you had any experiences with telehealth? You tell yours, I'll tell mine.
All right. So when it came to telehealth, I didn't have any personal bad experiences. All my experiences with telehealth was good because I only because I know I got either the email or the phone number to the person I need to reach. So for mine, it was good. But
Good.
if someone else had to get to somebody, I just called the person directly that I know. I'm like, look, so and so trying to reach the organization and they can't get through. So you do something.
Yeah. Over the past 6-7 months, I've had a lot of issues. I've been going back and forth to the doctor, and because of COVID, we wasn't able to go and get like my in-person checkups. Like I have some issues with my heart that I had to like take care of, and I did a lot of telehealth, like a lot of telehealth through this, right? Like I was able to call a 24-hour nurse, and the nurse was like, okay, go to the urgent care, get that checked out. Even when I came home and after I had my procedures and everything done, most of my checkups have been via telehealth, right? Even with my all of my specialists and everything, it was great to be able to do that. I mean, I've taken calls. I've been in the car, been able to pull over, chat with the doctor really quick, get that information, talk to the doctor, and everything. I was able to go in, get my labs done, and then talk to my doctor telehealth. It was and it helped because I didn't have to go out and put myself at risk for COVID. This was in the heat of COVID, right? Which was like the worst time to get sick.
Exactly.
COVID because you had to go. But it helped. It made me a little bit more comfortable to be able to know that I can go get my blood work done. I can do everything I can do, using telehealth. My doctor, was able to pull up my records, all my specialists, able to talk to each other, and it didn't take anything. It did. I even did COVID tests virtually, which was interesting. Like the first couple of times I went in person to do it, and then after a while they said, "Oh, you can have it sent at home." And I was like, "Really?" So I even did my COVID test using telehealth, which was interesting. Having a doctor up there and doctor telling you to swab and do everything. It was interesting to do that, but getting health care through telehealth, really showed that we do have the ability to reach everybody anywhere. We just have to make sure that everybody everywhere has access. Access is a big thing. And turning it back to the status neutral approach, if we can, do this, that would be that would be a lot helpful when folks will be engaged, however, wherever they are. So I'm going to talk a little bit about, like I don't already talk, right? About Black Pride and the new approach to COVID. Last year, we had to cancel DC Black Pride because we didn't know what was going on. We didn't know. And, I come from a public health background. I see our president comes from a public health background. So back in February, March, when, everybody was kind of confused and we was hearing information from the higher ups, like, don't worry about it. It's gone by, what is it? It'll be gone by Easter. It'll be, those of us in public health was like, no, it ain't. You know what's going on, right? So we made a hard decision to cancel Black Pride just really out of the benefit and health of people. And you would be surprised how much hate mail we got because of that. People
I know.
And then, but then DC wasn't even open, right? Because DC had shut down completely by then. As a matter of fact, DC shut down my birthday. DC shut down my birthday weekend. I never forget that. But so what we did was we had to, coming this year, we all decided that we didn't want to completely cancel Black Pride again, right? But we also didn't know when we'd be able to gather. This was back in like January, February. So what we did was we launched the 12 months of Pride. 12 months of Black Pride, I'm sorry, which was, in February for Black History Month, we launched it. And then we do something every month, and we're doing it virtually. And then as things open up, we was able to do it. And, last week, wow, yeah, it's been a couple of days now. We had the DC Black Pride Comedy Showcase that we had a small little crowd, got everyone together, was able to stream it online. And as we're moving forward, we're going to start having more and more in-person things. Like in June, we're having the DC Black Pride Pool fundraiser. We're having our award ceremony, which you are one of our award recipients. We're actually going to be having that in July. We're going to be having, the scavenger hunt. We have a whole slew of things as we're moving forward in the everything is open up and we've seen the vaccinations increasing within our community, we're going to having more and more in-person events, which is another thing too, that we really are going to be working a lot, very closely with DC Health, very closely with the mayor's office, very closely with everyone to increase COVID testing and COVID vaccine, because that's the way we're going to get to the end of it. So tell me a little bit about your thoughts about this 12 months of Pride and how we was able to navigate this during the COVID pandemic.
Well, once I heard about it and we discussed it, I loved it. I was like, oh, that's sweet. We could do something every month representing Pride. Because, I mean, for me, every day is Pride. Because, that's just my life. Yeah, that's just my life. That authentically speaking, I tell people, I say, I'm not gay, I'm an alien. It is what it is. I'm my own unique spirit. But when it came to 12 months of Pride, I was just like, that's wonderful because that still let people know that we're here, that we still want to make sure that we're available, that we still care about the community as a whole, that we're going to be doing stuff, regardless if it is, in person, like you said, but we're still out here, still educating, still making sure that you stay informed, stay updated, have fun virtually. Because, like you said, this is still fun. We may not be face to face, but this is still fun. We still having a great conversation, laugh, a good time. I mean, like even with the events that's been going on, like everyone was like, "Oh, I thought Pride was canceled." I was like, "Well, they ain't got nothing to do with DC Black Pride."
Yeah, there's still events happening. Yeah, there's still events happening.
I was like, as long as they got approved. I was like, as long as the events got approved, they fine. People still have a party. And we're still wear your masks.
Yeah, we're still working with all the other party promoters and everything because we understand that folks are still want to come. Visit dcblackpride.org for all of our upcoming events. And the next time we do this, Strawberry, we're gonna do it in person.
Of course.
We want to do it in person. Tell me a little bit about your thoughts on the comedy show. The comedy show that just happened.
So I love the comedy show. I love the location that we had because it was beautiful. It was welcoming. I love the people that we work with. Shout out to Xfinity. I got y'all Wi-Fi. But no, that just the location was like in Gallery Place, and it was in this beautiful setting. And the people that we work with was just wonderful. They was all professionals. We all worked together, making sure we all got what we each other needed. And it was a small, little condensed area, but we had a wonderful time. It was a good time. It was a wonderful turnout, and it was nice. I loved it.
Thank you. Shout out to Alan Atkinson, Alan, our media person from Allen Media. He did a great job of making sure everyone looked good. This has been great, Strawberry. This has been great. Catching up with you. I feel like I haven't seen you in so long. Every time I talk, but I just saw you a week ago. Well, we didn't have official conversation, so this is good.
I know, right?
I want to thank everybody for tuning in to learn more about all the things we discussed today and more. Around the status neutral, visit statusneutraldc.org, visit gettestedDC.org for more information about getting at-home test kits, DC beings, everything. Strawberry, any closing comments, last words you want to leave for the people?
Sure. If you live in the DMV area, you can use the link linkudmv.org. It'll show you like all the locations to everywhere, whether you're gay, straight, bi, however you choose to identify. It will show you anything that you're looking for. Go to linkudmv.org. As far as like health-wise, housing, anything, just put your information in on there and it'll show you everything around your area. And my last closing mark is learn to love you, learn to accept you, because only you can live with you.
There we go. Yes. Thank you for that closing statement. Strawberry and I are both readily available. We're both available. Hey, kitty, your kitty wants to be on camera. So I think you need to be space for your kitty. We're both available on social medias. Shout us out. Hope you guys enjoyed this conversation. You want to learn more about what's going on in DC Black Pride and 12 Months of Pride, visit dcblackpride.org. Or if you're not from DC area and you are interested in finding about what Black Pride is happening in your area, visit centerforblackequity.org. The word FOR, blackequity.org. And thanks again. Thank you for spending time with me today, Strawberry.
No problem. Thank you for having me. And shout out to DC Beans for having both of us.
Shout out to DC Beans for having both of us. Thank you, everybody out in the audience, for tuning in with us. Hope you enjoyed the conversation. Hope it was beneficial to you. Again, my name is Kenya Hutton, and I'm signing off. Thanks, everybody.
Bye.